invite Dr. Bhatt now to give his talk on Clarus.
You've seen almost everything up till now. So this talk is just enjoy the images for the next maximum 5 minutes. It will not be longer than that, definitely. Okay. So the most important advantage of this machine here is it uses a white light, hence it is absolute true color, and the resolution is mind-blowing. You can zoom it to whatever extent you want. A single image is 135 degrees, and you can have 2 or 4 images. 2 images are about 170, 4 images around 210 degrees. You can see right up to the periphery with that. And 4 image montage, you don't see the montage line at all. And it covers, probably 90% of course not the entire retina, but 90% of the retina. And still, it is absolute true color. What you want, we see that. That's the advantage of this. So this is a case of, and it takes a little time, maybe about 30 seconds or 40 seconds to acquire this. But it is accepted very well by the patient, and the color is absolute true to what we want. These are peripheral degenerations plus can see the aura very well. You need to slightly angulate the machine to see the aura. It could not come in a standard image absolutely clearly, but it still is possible. So this was our fantastic horseshoe there seen at the periphery. I could pick it up on ultrasound also. Sorry to say that, but ultrasound can also do it. Okay, so the case of choroidal granuloma, which at the right you can see up to the periphery. It's seen very well on USG also. That this image that I brought here is to see the excellent resolution that we have. We can really zoom it out to what he was talking about, the Heidelberg, where you can see the macula, and you can really see the macula at high resolution. So I'm not going to cases. This is just showing you the images at glance. We can all go. The FAF is also very good on that, and it has both blue and green. So you can go to any extent and see that. We had the fundus with healed serpiginous. You can see the 2 resolutions on blue as well as on the green on the other eye. It's a healed case, and single area can be seen very well. Another case of serpiginous where you can see the entire extent. So this acquires in probably 3 to 4 seconds. It's just 2 images and they montage automatically. The importance just the next few minutes is to have the forum software where you can overlap the image of OCT, the angio and the fundus on one picture, and you can have one-to-one correlation. But it's not possible on the machine. It's on an external server. Now this patient was a myopic patient. Axial length was around 37.5 millimeters. Such a high myopia staphyloma. We could see the posterior pole quite well on this. So here, just see this video. We have these images outside. So yeah. So this is the tracker. I don't know why it's not playing. Okay, now it will play. You can move this tracker wherever you want. So you have a fundus and the OCT correlation. This is only simple fundus and the OCT correlation, and then you can add angiography to that particular area which we are interested. So the case of peripheral vascular malformation, which we saw on the nasal quadrant, and on the OCT angio also it is seen very well. Because we know the entire area, we could see it on OCT angio. So we have NVD where you have the OCT, fundus and octa. We can have actual point one-to-one correlation, and the same NVD. The important thing in choroiditis here is that if you want to see the atrophic areas, choriocapillary atrophy that is seen here, you can overlap the 2 areas of the octa, the choriocapillary slab, and know the exact area. So this is like FAF, FAF, but you can have one-to-one correlation. So this is a case of very high myopia, myopic fundus, and a suspected CNVM. Now, if you see on the fundus itself, it looks like, but we are not very sure. Even the it was posterior staphyloma with an axial length of around 32, 33 or so. And then we did the octa over here, and that particular area, I could see the CNVM. I was not sure whether this is a CNVM, but when I saw correlated with the fundus finding, then this area became a myopic CNVM, which could be seen very well on the. So correlation between these three, and the same area can be seen on the OCT also. This is the same area, the OCT. So this correlation is possible with the external software. So this is just the last slide of PB CRV, which I saw over here. The point home that I want to drive is that it's true color, easy to acquire, very easy to for it to do an auto montage, and you can have correlation between all three and know the exact area.